Okay, see everyone coming on in. Great, welcome everyone. Okay, why don't we get started? Good afternoon, everyone. My name is Ben Becerra. I am the co-director for the CSUSB Center for Health Equity. And we are very lucky today to have a presentation on two programs, the Future Physician Leaders and Health Coach program for our CSUSB students. So with that, I would like to take it or I like it so that our speakers can get a chance to talk about these amazing opportunities.
Thank you. Thank you for having us. My name is Esmeralda Trejo, and I'm the Assistant Director of Pipeline Programs at the UCR School of Medicine. And I'm also the Future Physician Leaders Coordinator. And I'll have my colleague introduce herself.
Hi, hello everyone. Good afternoon. My name is Jacqueline Loya. So I have the pleasure of being one of the community health instructors for the FPL program I will be reviewing today, as well as coordinating our health coach program on the UCR School of Medicine side. So looking forward to hearing from all of you and hope you take this opportunity to ask questions because myself, as someone that has gone through programs before, understand that you can't get the best answers just from an overview. It's always best to ask the actual participants about their experience. So we'll have some people sharing about their experiences in the programs as well. So we'll encourage you to unmute yourself or put your questions in the chat to ask those questions. So what we will be covering today. So first and foremost, we like to review our mission and values at the UCR School of Medicine. And the reason why we do that is because our programs lie under the UCR School of Medicine. So we are very much in line with what we embrace here at UCR SOM. Also, we will be going over some general requirements for applying to medical school. We also understand that some of you here might not necessarily want to go into medicine, but interested in public health or just other healthcare fields like nursing and pharmacy. So we welcome you to, again, apply to our programs because they're open to all people interested in all healthcare fields. But because we are with the School of Medicine, we will go over the general medical school requirements and application process. And then lastly, the meat of our program today will consist of reviewing the application process and the program benefits and components to each of our programs that we'll be covering today. So the mission of the UCR School of Medicine. I love talking about this and particularly covering it in this slide. And the reason being is because at the UCR School of Medicine, we aim to serve the inland Southern California region. And what does that region consist of? It consists of San Bernardino County, Riverside County, and Imperial County. And the reason why we aim to serve this region is because we recognize that it's an underserved area, an area where we have a lack of a diverse workforce. It's getting better throughout the years. It has improved, but there aren't enough of us that are serving this community. So we're aiming to build a diverse healthcare workforce specifically by training our future physicians that we hope will serve this area. We also do this through innovative research and by developing healthcare delivery programs that will hopefully improve the medically underserved communities that live here. So with that said, the reason why we get so excited, Esmeralda and I, to talk to all of you is because we recognize that you all have strong ties here. Whether you want to recognize it or not, a lot of you grew up here, a lot of you are going to school here now, and we want you to come back and serve this area. So we hope that throughout today's presentation, you look at these programs as an opportunity to continue to give back and continue to serve the communities that you're a part of. So before I let Esmeralda take the presentation over for this part, I just wanted to again be mindful that although we are covering the medical school application process and general requirements today, you are all more than welcome to apply to the programs, even if you do not wish to apply to medical school in the future. And we are not admissions officers ourselves, but we are happy to provide you with our admissions team's email if you do have general questions around our UCR School of Medicine admissions process. With that said, I'll let Esmeralda take it away from here.
Thank you, Jackie. Yes, so like Jackie mentioned, even though we don't necessarily review your applications or work with the admissions teams in terms of promoting medical school, we do want to make sure that our pipeline students understand the requirements, and we do work closely with the team on the behind the scenes of more of what is it that they're looking for admissions, how can our pipeline students be more competitive and be ready for their next step if they decide to go into medical school. But again, like she mentioned, you don't have to go to medical school to be part of our pipeline programs, as long as you care about working with the underserved community and being part of any healthcare profession. So just in case you are interested in medical school, I provide the requirements for UCR School of Medicine here on the slide. On the left-hand side, you'll see the required courses, which I'm hoping you are familiar with. I do recommend you going to your advisor, your faculty advisor, but also your health professions advising center to give you more advice and feedback on making sure that you're completing these requirements to be eligible to apply for medical school. I do want to highlight our recommended courses. So remember, these are just recommended, they're not required to get into med school, but they do help in your application, especially helping you take the MCAT, for example, your humanities and social science, since I know the MCAT was altered a few years ago or changed. And so just be cognizant about those components. But I do want to highlight the Spanish language requirement that is just recommended. But the reason why we have a Spanish language is because we have a lot of patients here in the Inland Empire that speak Spanish. And so we really want our medical students to be familiar with medical terminology when they're working with their patients, and having that Spanish, at least some form of holding a conversation with their patients, is very valuable. But do not feel like you need to go take a Spanish class just to fulfill that requirement. It's okay if you don't speak Spanish, and it's okay if actually you speak another language. You can definitely write that on your medical school application and you'll still be just as competitive. So apart from just looking at your grades, because we all probably have heard medical school is difficult and we need to have good grades, we also like to see, what else are you doing as an individual? What else are you making your application more competitive? Make it, for the admissions committee to look at you and say, I want this student to come to my med school. So as UCR specifically, they like to see someone who's involved. And if you haven't already kind of caught on the theme, we like working with our community. So community service is a huge component. We like to see students who are getting involved in maybe San Bernardino Riverside area. Also, if you're from like maybe the Coachella Valley or Imperial County, getting involved in whichever your community is from. Why is it that you want to work with these community members? Why do you want to become a physician? Do you want to work in this area? So that's kind of like what we like to see in a student. We also like to see a lot of clinical experience. So that's something that we really highly want to express to you, that we don't really look at shadowing experiences as highly as maybe other medical schools might. When they're shadowing a physician, I know that's very popular and a lot of people want to get those opportunities. We actually like to see more of the patient interaction. And so we will be talking about health coach, which will provide you that experience and in a little later, but just kind of keep that in mind, that we like to see more any clinical experience, any patient interaction. And then leadership, if you are, holding an officer position, or maybe you were a team leader in a group project, that's leadership. Professional development, if you present at our conferences or you're doing research, that's something that we like to see as well. And of course, employment. I'm sure a lot of us have worked, multiple jobs, possibly going to school, right? It doesn't have to be medically related. It just can be any job that you hold, and maybe you got a leadership position within that job. So if maybe you worked at a McDonald's and you were a team lead, right? That's a leadership position. So anything that you can tailor to what you've learned from that experience and how that makes you the person you are today, you could definitely want to write about that in your application and mention that in your med school application. So don't feel like any experience is it's a small experience. Okay. So this is just kind of an overview. We do holistic reviews, so we want to make sure that our students are aware of how we review our applicants. I did want to provide you this kind of snapshot of our pipeline program. So if you've never heard of pipeline before, like when Jackie was talking about our School of Medicine, when it opened up in 2013, but we've had some of our pipeline programs since 20 years ago, actually. So when the medical school started, back when we were in partnership with UCLA and UCR, we wanted to really grow our own students to go into medical school, and we needed to prepare them. So that's kind of how pipeline started. And as time went on, we've added more programs throughout at each step of the way. And our hope is that by the end, they will come to our medical school and essentially, practice in the Inland Empire. So we've grown a lot, and total we have about 10 programs. And you can, even though you go to Cal State San Bernardino, you are still able to participate in a few of these. So don't feel like you can't do any of them. We have 2 programs today that we're going to talk about specifically that you can be part of that will make you still competitive to go into medical school. So with that being said, we're going to move on to our first program, which is called Future Physician Leaders Program. This one was actually founded back in 2009 by Dr. Raul Ruiz, who's a congressman in the Coachella Valley area. And he's an emergency medical physician, and he saw that there was a large need of physicians in Coachella Valley specifically. And of course, like Jackie mentioned, other areas here in Inland Empire. But he really noticed that we need a lot of physicians, and we need our students to really envision themselves becoming medical professionals. So he started mentoring about 10 high school students and getting them to go into medical school. And actually from those 10, now we know at least 2 of them are, one of them just graduated a few years ago, and another one's going into her 4th year here at UCR School of Medicine. So we really wanted to continue this program. He joined our medical school back in 2012 and then became elected as congressman. But now, we still continue his program, and we've expanded now to the Riverside area. So we definitely want to continue the mission of, growing our own students here in the area to come and serve the community. So we are in a summer program. So it's 9 weeks where you'll actually be, working in a community service oriented project, which I'll go over in a little bit. Our dates are from June 14th through August 10th. So just kind of be aware of those dates, because I know sometimes some students might be interested in taking summer school or working. So just be mindful of that. There is a program calendar on our website, and I'll go over some of the meeting times and time commitment. There is a program orientation if you are accepted into this program on May 18th in the evening. So that is mandatory to attend. There might be a Saturday component just in case you're unable to, if you have finals or classes or anything like that. But please try to make sure to make that orientation if you are accepted. And then everybody does have to participate in the program symposium. There are 2 locations. And I know that, we're probably, in the San Bernardino area, you can apply to the Riverside San Bernardino site. But I really want to encourage you to apply to your hometown, which one's closest to you. So if you live in Palm Springs and you take the bus to go to Coachella, or to Coachella and San Bernardino back and forth, I would want you to really apply for the Coachella Valley site. Even though our entire program will be completely online, I really want the students to pick the ones that are closest to their hometown. So just kind of keep that in mind. Preference will be given to students who have some kind of ties to the Inland Empire, Riverside, or San Bernardino County. So for obvious reasons, we really want to grow our own. You, by attending Cal State San Bernardino, already have ties. And if you live here, you've grown from here in this area, you even have more ties to it. So we do definitely look at different factors into your application. And you must be a minimum of a junior in high school. So of course, by being at a Cal State, you already are meeting the requirement. But I just let you know that just in case you have other individuals that might be interested in this program, you do not have to be a UCR student. You can be a high school student, or you can even be a recent graduate. You are still able to apply to this summer program as long as you have not gotten a master's degree or a graduate degree. Like I mentioned, our program is completely online due to COVID-19 and will continue to be online until further notice. So just kind of be planning for that and have a reliable internet connection to make sure that you can attend the sessions online. So what exactly is the program? There are 3 major components that everybody needs to take part in. So the first one is a community health project where you will develop a community health education, where you'll go out and actually present it and gather some data. And I'll go a little bit more into detail of that. The leadership lecture series allows students to meet different guest speakers once a week and really get in network with other healthcare professionals. And again, we don't always get medical doctors, we get people from different areas of healthcare. And the program symposium, you'll actually be able to create a poster style symposium where you'll present your project to other individuals, organizations, UCR School of Medicine staff and faculty. So it's a great way to really put that into a poster session for medical school or any graduate school you're applying for of your presentation. And then the optional portion is a mentorship program. This is fairly new to FPL. If you were familiar with the program a few years back, we had a shadowing component, but due to COVID-19 last year, 2020, we decided to pilot a mentorship program with few of our students would be paired with a medical student and do weekly activities to prepare them for medical school specifically. That was such a fantastic program where students were really excited to be with a mentor and they wanted this program to actually continue. We've decided to continue the mentorship program and will be phased out our shadowing component. So if you are interested in the mentorship program, there is an additional application process, and I'll go over that in a little bit as well. So the community health project, this is the meat of the program. So make sure you really understand and ask questions if you have any regarding this component. You will be placed in a team of about 5 to 7 individuals, and we make your groups, and you will be working with different folks. So you're not just going to be paired with Cal State students, you'll be with UC or community college students, or even a high school student. And you're going to work together to think of a health topic that is affecting your community, and you want to bring awareness to the residents about this topic. So here we provide a few examples, but feel free to think of anything that you are interested in, because you'll be writing an essay question when you apply to the program regarding what health topic you want to talk about. The commitment is about 15 to 20 hours a week. I know that might seem a little large, but again, this is a 9-week summer program and there's a lot of components, and we want to make sure that you understand the commitment level, especially if you're thinking about doing summer school or working, right? So this includes the 15 to 20 hours going to lecture. So lecture is once a week for the community health project, but outside of that, you need to meet with your group and create all the presentation materials. So developing it, doing the research, doing the presentations, doing the website, the flyer. So if you've never done any of these things, do not worry. We will give you the tools and the training to create these engaging presentations and a website design. And then you will actually go and present through Zoom to the community members. And then you will collect data. You're going to gather some surveys and make sure that your topic or health education was actually effective, and how effective was it. And we are going to do some data analysis that Jackie, who's our instructor, will help you through that. And that way at the end, you will create a written report and a poster for the program symposium. So just make sure you have enough time in your schedule to dedicate to the community health project and to your group efforts. Here are some examples. Just wanted to show you what was done last year. Some groups did an awesome job and wanted to do more than just a website. They created an Instagram, a Facebook, a TikTok. So you can, be as creative as you'd like. The more you put into the program, the more you'll get out of it. And then the lecture series, again, you meet once a week as well, and you have different guest speakers. We've had physician assistants, nurse practitioners, researchers, residents. So it's really anybody in healthcare, and we really like them to share their experience. And sometimes they share some volunteer opportunities that you can be part of the following year. There are some journal reflections again, it's like a class, and we want to make sure that you're getting the most from this program. And like I mentioned, the program symposium is at the end. Everybody does a poster, but if your group did an awesome job, you might be selected to do an oral presentation at the symposium or at the UCR School of Medicine conference. Mentorship program. So if you are interested in being part of the mentorship program to be considered, you do have to submit an online application. So everybody submits the FPL online application, and there's a question on there that'll ask you if you want to be considered for mentorship. It's if you say yes, you do have to submit a letter of recommendation, and a letter of recommendation can be a faculty member, it can be an advisor, community member, anybody that supervises you, so an employer, but no family members or peers can write your letter, your resume, and then an unofficial transcript from the different institutions that you've been at. So if you were a transfer student, make sure to include that transcript as well, all into one document in the PDF. So the commitment for this is an additional 2 to 3 hours, because there are some additional writing assignments that you need to do for the mentorship and meeting with your mentor. So if you do get accepted for the mentorship program, please make sure that you do not have other commitments outside of just maybe working part-time, possibly, but not doing summer school and working, because you want to make your schedule very, very open, because the medical students have sometimes clinic, and you want to make sure your schedule tailors to them and when you can meet. So just be cognizant of that being part of mentorship is a privilege that not everybody gets. Only 20% of the applicants actually get mentorship. So just even being awarded that is a great experience, and please make sure that you are able to have the time commitment to fulfill those times with your mentor. So the application here is kind of like a snapshot of when you'll be meeting. So Mondays and Wednesdays are the Coachella Valley if you decide to apply for that region. Tuesdays and Thursdays are Riverside, San Bernardino, and it's all in the evening. So you do have to attend those. The rest of the time will be up to your group. So whenever you're available, that's the beauty about having Zoom, is that now you can kind of be a little bit more flexible in meeting times. So just be cognizant of that. And then everybody's supposed to participate at the program symposium that will happen in the evening of August 10th through 12th, and will also be online. The application is now open on our website, and I'll be sharing the link at the end. There's 5 short essays for the regular application everybody needs to complete, but if you want to be part of the mentorship program, you'll need to submit those additional documents that I just mentioned. So benefits of it, definitely learning a little bit more about health disparities and equities, social determinants of health, what is affecting our residents here in the Inland Empire, and how are you as a future healthcare provider becoming more aware of these factors and how you treat your patients. Of course, it's a lot of public health research, and Jackie does an awesome job of being an instructor and teaching our students of thinking about public health issues happening. And then public speaking is a big one, communication and marketing. So those are some skills that we may not have, or we might have a few of those, but maybe want to become stronger in them. I definitely do suggest you try FPL. It is a life-changing experience for the 9 weeks from the first session to the last. So if you are someone who's shy, not sure, or maybe you're thinking about healthcare, but I'm not quite sure, FPL is a great way to develop those skills. And then networking, like I said, you're going to meet different, not just professionals, but also peers that you can definitely keep in touch and maintain a conversation and friendship after FPL. So here are some deadlines, just so you're aware. The priority deadline for mentorship, if you decide to apply for mentorship, is April 7th. But the final deadline for just the regular application and for all sites is April 28th. You will be getting a notice if you're accepted around early May, and the program orientation is May 18th that you'll have to attend. So everything can be found on our website online. And then if you have an Instagram, feel free to follow us. We post a lot of great content on there. And yeah, so if you have any questions, there's my email, but I'll open it up right now to our former participant, Michael, who will share a little bit about himself and a little bit about his project.
Hello, everyone. Can everybody see me? Okay. Hi, my name is Michael Alonso. I attended California Baptist University. The site I participated in was Riverside, San Bernardino during the summer of 2018. And so I really enjoyed my experience with the FPL program. And so I wanted to see how I could get involved more. So I decided to apply for, and I joined the Student Leadership Committee, and I've been on since 2019 until currently. my community health project, we decided to do stroke awareness. We thought this was a great topic to inform the community members about, given that stroke, time is of the essence, signs and symptoms, things of that sort. So being able to educate the community, empower them with some information that could really have a significant impact on people that may be suffering from that. So we did this via attending local health fairs. We teamed up with the American Heart Association local chapter. They provided us with pamphlets, booklets, information about stroke, health, heart healthy information. And so we did that through tabling events and just kind of engaged with the community, talked to them. Some people even came up directly to us at the time, mentioning their experience being affected with by strokes, whether it was their neighbor, family member. And so it was kind of a nice, rewarding feeling just knowing that even at that time, we were able to connect with people in the community. And so I really enjoyed that aspect. Overall, the program with the leader lectures series, and just kind of, it really gave me that aspect of the community when it comes to dealing with medicine and dealing with patients. And so I think it really allows you a great opportunity for that. Definitely working teamwork. It's another great experience for this as well. Time commitment, definitely keep that in mind as we mentioned. Hopefully now that everything is a little more digital, given with COVID, hopefully it's a little easier to not have to worry about driving and stuff like that as I had to do before. But again, keeping that in mind, it is what you get out, what you put into it. And so even at the time when I did it, I had already graduated from CBU. I was already having a clinical job, but still the FPL program provided that community aspect that I didn't get to experience as much before. And so I definitely enjoy that. And so I really hope you decide to apply and join us for this summer. Thank you.
Thank you, Michael. And Michael just completed our UCR postbac program, so he's been a wonderful asset to our pipelines. So now I'm going to turn it over to Jackie, who will be talking about Health Coach.
So hello again, everyone. That's always a hard act to follow. I hope all of you are now being encouraged to apply to the FPL program. So as Esmeralda said, the FPL program runs over the summer. So you could potentially, if you qualify for both, actually do both programs. And the reason why is because the Health Coach program is an academic program, meaning that it runs from September and June of every year. So it's going to run through an academic calendar. Now, before I get more into details around that, I do want to recognize a couple of people and the partnership between UCR School of Medicine and the Riverside University health system. So the Health Coach program has been around since 2013. And the reason being is because of the vision of two individuals, which are pictured on your screen there at the bottom, right under a wonderful picture of some old health coaches of ours. And Jeffrey Liang is a physician at Riverside University Health System. He actually oversees the family medicine department along with some other departments there. And he attended a conference at UC San Francisco before we had our health coach program. And that's where he learned of the health coach model. And he loved the idea of having individuals basically address the health literacy issues in between visits with the provider, because he himself as a doctor acknowledges that, you know, you only get about 15 to 20 minutes with the patient, and that's just not enough time to really answer their questions and provide the health education that they need to empower them and make sure that they understand what are the reasonable and flexible goals that they can set for themselves on a day basis, so that they can reach that overarching, wellness goal that maybe he had discussed with them. And so he came back from UC San Francisco very empowered, and he knocked on Dr. Neil Sheeler's door. Now, Dr. Neil Sheeler at the time was overseeing the UCR School of Medicine Student Affairs Department, along with other departments here. And under the Student Affairs Department is the Pipeline Programs team. And so Dr. Liang said, I understand you're building a lot of pipeline programs and you have some already. And one that I don't see there is a program that allows for pre-health individuals to gain some hands-on clinical practice in the field. And I came across this wonderful health coach model. What do you think? Do you think this is something we can partner on? And obviously, Dr. Schiller said, yes, I do. And so when we started the program management staff actually came from the UCR School of Medicine. Now, the program has grown so much, and the county has had more personnel to assist with the program. So now there's also program management staff that you will interact with a lot if you do the health coach program. And they cover more of the clinical day-to-day relationships with the health coaches. So what are the aims of the program? Since, we've grown so much since 2013. Well, the aim is to, one, train future pre-health individuals. And so we're looking for people that have a strong passion for the field and know that they want to work in the clinical healthcare field and at some point or the other, but just need some more hands-on experience. And the other aim of the program is to also support those individuals through professional development and preparation for the healthcare graduate school, specifically as they prepare to apply to graduate school. So with that said, let's dive deeper into the program description. So just so you understand the commitment, once again, you'll hear me reiterating, it's an academic year program. So we want you to be able to volunteer between September 1st of 2021 through June 30th of 2022 if you apply for this next cohort. You will also have to do a general program orientation during the last week of May, and that's not only to introduce you again to myself and my role within the program, but also our Riverside University Health Systems program management staff. On the other side of that as well, during orientation, you're going to be instructed on some of the onboarding that you'll have to do the summer before you actually start health coaching. So that's between June through August. And a lot of that is more so paperwork. And the reason being is because if you are a health coach within the health system, you're going to be allowed to use their electronic health record system, which means you get to access a lot of patient health information. And because there's rules like HIPAA, which means we have to protect the privacy of patients, we need to make sure that you are trained and cleared to be able to access those tools when you start in the fall. So with that said, you will also have to do a background check. I like to mention this because I do get questions sometimes or from individuals that maybe don't have a legal status here. So if you have DACA, you can definitely still apply. But unfortunately, if you do not have DACA and are considered non-documented, we encourage you not to apply. And again, that's for your safety as well because of we just don't want you to get rejected. Like the county is not going to allow you to volunteer, unfortunately, if you don't have a social security or a working permit. So although you're volunteering, they still have you do some very similar requirements as if you were an employee of the system. And just to give you an overview of who can go through the program or how many seats do we have in the program every year. So we take in about 30 to 35 health coaches every year. This last application cycle, we had close to 100 applications. So I always tell people apply early. Early is better. And we do have 15 total different clinics that you might be placed in. You only get matched with one, but there's, I guess, 15 options for you. So when you apply, I encourage you to mark your preferred site because we'll do our best to match you with your preferred site. But just note that you might also be matched based on need of the clinic. So collectively, our health coaches serve over 1,000 patients every year. And they also put in over 6,000 hours collectively, right, as a team. So the work that they provide is amazing, and they're definitely valued as a vital healthcare team member. Now, because of COVID, we have reformatted our program to be in a hybrid model, meaning that our health coaches right now did have to go through in-person training. And if you do the program for this next academic year, you yourself will also have to do in-person training. Um, and if we're still allowing at the time telehealth medicine for our health coaches, then you might have the option of working remotely from home and basically just talking to patients over the phone. But for the most part, when we're not, going through this pandemic, we encourage our health coaches to work in the clinic. And that's because there's just nothing better than in-person patient interaction to really understand the hands-on clinical experience. So I just want you to note that because I know some of you might be living back home. And so when you're doing this program, you do have to be relatively close, or at least within San Bernardino Riverside County, to be able to do volunteer. So in terms of time, what are the expectations? You're going to be asked to volunteer a minimum of 8 hours a week, or a total of 32 hours a month. Most health coaches choose to do this by coming into clinic 2 half days. So they'll do maybe a 4-hour shift on a Monday, for example, and then another 4-hour shift on a Thursday. Now, I do want to reiterate, these are clinic systems, primary care clinics, and they operate mainly between Monday through Friday and 9 to 5 hours. Some of them will close a little later, like around 7:30. But in general, your hours are going to be asked to be done through a Monday through Friday schedule. There's a couple of clinics where that might be an exception because their operational hours do have some weekend hours included. But I will guarantee you that only about 10% of your hours, even if you work within those clinics, might come from the weekend hours. For the most part, you will have to do your hours during the Monday through Friday shift. So just make sure, again, you have the time. A lot of our health coaches do work, some of them full time, and some of them also go to school full time. So not both, usually just one or the other. And finding the time to commit to the health coach program can be difficult if that's your case. So just make sure that you have the flexibility. I myself really support your wellness. And so if you're applicant that just doesn't have the time right now, then this is probably not the best time to do this program. Or I would suggest that you make arrangements, because again, you don't want to burn out. It should be a good experience, and time commitment is important for you to be able to get the best out of the program. Now, in total, in order for you to get a certificate after completing your hours, you will have to do 260 volunteer hours within that academic year. So if you don't reach the 260 hours, then we can give you the certificate of completion. Now, up to 40 of those hours can also be used for outreach events. So, for instance, right now I have a health coach here, which we'll talk a little bit later about her experience. And she can use her time talking about, coming here and talking about her experience as time on her timesheet, stating that, she was helping to support an outreach event. So, up to 40 of those hours can be used for outreach events as well. Now, in terms of expectations, so what we're looking for in applicants, we're looking for people that have good professionalism, that are good team players, and that are strong communicators. So the reason being is because when you're going through the program, you're going to be required to do trainings, you're going to be expected to be on time, to have good time management skills when it comes to your work life and personal life as well. And you'll be expected to follow established protocols and procedures that the county health system has put in place. And so because of that, because you're representing the UCR School of Medicine and you're also representing yourself while you're there, we expect you to act and behave with the ultimate professionalism. And that's going to just help you in all aspects of your professional development as well. I hope that all of you are all already very professional, and I'm sure your uh, Cal State San Bernardino colleagues would be very proud of you as well if you maintain that professionalism throughout the program. Now, in terms of teamwork, you will be working with the healthcare team. So, what you are not doing as a health coach is you are not diagnosing a patient. Basically, what happens is a provider, and that could be a doctor, that could be a dietitian, that could be a nurse, might see a patient and they're diagnosing, they're following up on medication adherence and things like that. And through conversation with the patient, they might make sure and to assess if this patient is a good candidate for the health coach program. And if they are, they're going to refer them to you after they see them. Now, when they refer them to you, there will be some documentation in the electronic health record system and then that referral they make. And that's going to show you what that health plan is for that patient. So you're going to go and approach the patient based on the health plan, but also based on what that patient wants to address at that point in time. Because what ultimately you're trying to do is just coach the patient into creating their own autonomy and identifying what are their barriers to their overall wellness and how can you and the healthcare system better support them through that. So with that said, the other important reason why teamwork is needed is because you're acting as a liaison and an advocate for that patient. So it's a partnership, right? It's not like you're telling the patient what they need to do. You're partnering with them so that they can build the autonomy they need to be successful. Now, in terms of communication skills, you're going to learn some wonderful skills that some clinicians, even now, were never trained on and just are still learning or how to learn as they did the job. And that's improving now. At the School of Medicine, we do train our future physicians on this skill, and that skill is called motivational interviewing. But unfortunately, not everyone had or has that privilege. So you will be ahead of the game when you do the program because you will be learning that. And communication is important not only because you'll need to be able to build trust with your patients, but also because you're going to be working with different people in the healthcare team, whether they're the office administrative staff, the people at the front desk, to the pharmacists, the clinical managers, the clinical leads. So it's very important that you have good oral and written communication skills so that you can ensure the safetyness of the patient and your safetyness as well, because you're working with um, other providers in a clinical setting. Now, in terms of benefits, so on the UCR School of Medicine side, what we provide are professional development workshops. Some of those workshops include things such as personal statement workshops. You may also be invited to interview workshops, whether those are in the multiple mini interview format, which is the format we use for medical school acceptance, or just general interview workshops. Those actually are coming up in this series I believe next month. And so anyways, you'll be invited to those. Whether you do health coach or FPL, I should say that, because as long as you've done a pipeline programs within ours, you'll be invited to that series. There will also be networking opportunities where you might be introduced to people that are already in the field or just medical school students, and they make themselves available to you during their time to just better support you on your journey through your medical school application if that's of interest to you. And then aside from that, I also have office hours where you can come in and right now it's virtual, so via Zoom. But in the future, if there's in-person opportunity, you have the option of coming in person or doing a Zoom call if you prefer, and that's better for you and your transportation needs. And so what we do during those times is just like you coach patients, I help coach you. So I help coach you through your professional development and through your wellness. And some examples of things that we might talk about. Sometimes we might be reviewing your personal statement, and I may be providing you some feedback and editing recommendations on that. Other times we may be practicing for an interview that you might have coming up, whether it's a job interview or a graduate school interview. Sometimes we're just talking about your time management and how to better manage your schedule and building a schedule that uh, best fits you and setting goals and a plan for you to do that. We might also build a roadmap for you or a timeline for you. So it just depends on what you want to talk about. In terms of wellness, I always ask individuals to set some sort of wellness goal because whether you become a doctor or not, as long as you're in a field where you are giving to others, you need to ensure that first and foremost, you're taking care of yourself. Because if you're not, that's how we tend to see these high increases in burnouts. And unfortunately, with this pandemic, we're starting to see that even more. We're starting to see increases in, for example, even physician suicide rates. And it's unfortunate, but it's the truth. And we need to talk about it. And so that's why I encourage you to set those wellness goals. And that's another option for you when you're doing the program as well. Now, the meat of the program benefits is obviously the clinical interaction and experience. So, most of the time, what you'll be doing is using motivational interviewing. And that is the skill that allows you to guide a patient towards building their autonomy and gaining some control in their healthcare management. So, it's a wonderful skill. As you all know, most of the time when we go see a doctor, we're given a diagnosis and we're told, take this medication and X amount of days, or, if you have like diabetes or chronic conditions, you have to continue with that. So make sure you're taking your medications and doing all these other things. And so you're being told what you need to do. And behavioral change doesn't really work that way. If, believe it or not, most of us don't really like to be told what to do. And so the motivational interviewing skill teaches us how to better coach people through making the changes that they want to do and helping them realize that and providing them the resources and the guidance to be able to do it, but ultimately giving them control of that. So it's a wonderful, wonderful skill you'll learn. Now, the electronic health record system that RUHS uses is called EPIC. And a lot of wonderful healthcare institutions use this. Kaiser Permanente is one of them. I believe Loma Linda University Health System uses this too. So it's a great system to just get familiar with, and that's where you'll be documenting. You even get your own patient management tool within that. So you'll learn how to manage your patients there. It's amazing the things you'll be able to get introduced to. And I will assure you, you'll be better equipped once you're actually in the field. And then the other part that I like to remind the program participants or applicants in terms of benefits is RUHS, it has been doing some really great work around addressing the social determinants of health. And so, aside from just addressing the illness and disease, they started using and they basically just created this health score assessment. And what it does is the health coaches are given the opportunity to ask patients a series of questions. And that survey is then sent to the rest of the healthcare team. And based on that survey, the healthcare team can assess if there's other things that this patient needs in order for them to live a healthier life. And those are things that are outside of the illness and disease. Maybe it's something as simple as needing transportation, and the health system can either provide that to them or connect them with a community organization that can support them by providing them some form of transportation. So, that's just one example of the things that could be addressed, but there's so many things that affect an individual's overall health, and RUHS is at the front line of addressing those. So that's another strong program benefit that you get, is just being a part of a system that is actively addressing the social determinants of health outside of just the illness and disease. So we're getting close to the end, and I just want to go over who can apply. So we're looking for individuals that the fall of 2021 will be in their third year or their fourth year of undergraduate education, or be considered recent graduates. And recent graduates, we don't define it by, X amount of years necessarily. It's just people that maybe already have a bachelor's degree, but are trying to get more clinical experience, because maybe they had a change in career path, or they're still trying to get into a graduate health education program. So any of those would define a recent graduate. We also uh, prioritize people that have strong ties here, and obviously our mission for our School of Medicine kind of addresses why that is. We want to see people that have interest in working with the underserved, and if you've had any educational or social economically disadvantages, I ask you to address those, and that why you want to be a part of the program. There's a question in the application, how have these barriers throughout your life journey affected you, and why has that motivated you to apply to this program? I want to hear that. So make sure you include that when you're applying if that's you. All majors are welcomed. You don't have to be a health or science related major. If you're an art major, if you're anthropology, sociology, public policy, I actually think that makes you a better applicant sometimes, because you understand, other things that maybe a science major might not necessarily have been introduced to through their educational journey. So not that they can't, they definitely can, but I just tend to see that sometimes people in the humanities, approach things a little different. So, I welcome all majors, and that goes the same for our medical school. Our medical school takes applicants all the time that have a various diversity in terms of their undergraduate majors. And then where you can apply, you're going to be going to hcp.ucr.edu. We're also going to ask for a letter of recommendation, like FPL, as long as this is not coming from a family member or a fellow colleague, meaning another student. That should be okay. Preferably someone that's had some sort of supervisor or mentorship role over you would be preferred. And then you also have to submit an updated resume in a PDF format, as well as unofficial transcripts in a PDF format. And there's more instruction on how to do that as well on our website. Now, although 3.0 science GPA is highly encouraged to make you a strong applicant, it's not absolutely needed. Again, as long as you can really make the argument, basically tell me your story as to why this program is important to you and how it's going to help you in your personal growth and professional development, then you can still be considered for the program. So deadlines to keep in mind. March 17th is our priority deadline. I always encourage applicants to apply early, because you are prioritized in the review process if you apply by the 17th. And that includes your application along with your recommender's LOR to be submitted by March 17th. The final deadline is April 28th. And then if you are considered a final candidate, you are going to be invited for an interview the week of May 10th. And the interview is in the multiple mini interview format. It will be conducted via Zoom. So all that means is that you're going to be going through different breakout rooms. And in each breakout room, you'll get 2 minutes to review a question, and then 6 minutes to answer that question with the interviewer. And then the week of May 24th is our program orientation. And that's when, again, you'll get to meet some of the Riverside University Health System staff. So with that said, I wanted to allow a wonderful health coach, Wajiha, to kind of guide us through her experience right now and allow her to share some tips for all of you that are potential applicants.
Thank you, Jackie, for that wonderful introduction. And Jackie did a really amazing job of summarizing and explaining the program. But I just wanted to give you a little bit of my background and experience with this. So this is my first year doing health coaching. I have graduated with a bachelor's from UCR. And so this was something I wanted to do to get clinical experience prior to my application cycle. To give a little heads up, this year has obviously been different. So of the many sites, I've been assigned the Family Care Clinic site, which is located in the main hospital at RUHS. And with COVID being as it is, that's definitely gone around with some changes. And what that has taught me has been to be flexible and adaptable with those changes. So an unexpectation, but nothing that couldn't be handled. And I think that's a great experience to have, especially with healthcare as it is, that it's a frontier that's always changing and adapting to new changes or pandemics as it has been this past year. So one thing that I did like was everyone talks about advocating for patients. And, you know, this experience and this program has been a great way to showcase that, because I get to work with a great network of people. I get to work with nurse practitioners, with nurses, physicians, with dietitians, and, you know, we work together to make sure that the patient's needs are being met. And those needs don't necessarily have to be needs that are specifically to their health, but that are definitely pertaining to their health. So Jackie mentioned transportation. It could be financial concerns. Recently, we've noticed a surge in mental health and social health necessities for patients. That is something that, you know, is definitely affecting their health overall. Another thing that has been a great experience is definitely working with the Epic system and charting. And for those of you that are feeling like you feel like you won't be prepared or you have never done something, I can assure you that all the training will prepare you for everything you'll be doing as a health coach. So whether it's charting, whether it's speaking with patients in the motivational interviewing, how to interact with the physicians and bring the needs of the patients up to the dietitians, all of that will be something that you will be given the training for. So as someone, I was never experienced when I came into it, and I feel way more confident than I did before I started the program. So I think it's a great way to, for example, patients will tell me something as a health coach that they won't necessarily disclose to their physician. So, you know, there could be a patient with diabetes and, you know, they'll disclose to me, you know what, I really haven't been taking my meds as I should be because I just don't have the means or financial means to take care of that. So even if they mention it to me, that's something that I can like talk to the physician about, and it might mean something that the physician or dietitian or nurse practitioner may not know. So it's a great way, like Jackie said, to be that liaison between the providers and the patient in any clinic setting that you're in. My experience so far, I have been going halfway. We've been doing a hybrid model. Some of them have been in clinic, but due to COVID and our clinic being converted into a COVID unit, most of my patients that I speak with are via telephone encounters. So that's just something to be cognizant of. I don't know what the situation will be if you choose to apply this upcoming cycle, but that is definitely a difference in when the program started. All of the shifts were in clinic. With that being said, I think that communication is a great resource that you will be picking up in this program. Jackie does an amazing job of keeping us in check with our mental wellness as coaches, as well as training us in some resources that we need, like interviewing skills, personal statement skills. I think I just met with Jackie and we learned about our leadership styles in our most recent meeting. So that was something that it's going to help you develop as a professional person. And if you really think about it, these are the experiences that you're going to talk about during your interviews to whatever professional health related field that you go to. And this is going to be something that you're going to take away from the program. These are the experiences, in my opinion, give you a way more patient interaction, hands-on experience than say a traditional volunteer role, because like I said, they're my patients, the patients that I get to work with. And that's the unique experience that I have yet to see in any other pre-health type of program. So highly encourage you to apply. If you have any questions, please feel free to reach out to Jackie, or if you have any questions about my experiences, Jackie has my information and she can give that to you as well.
Thank you so much, Rajiha. I appreciate you giving a good just picture for our potential applicants. So Rajiha is amazing and we enjoy having her. And We hope that all of you, if you are eligible, will consider applying. If you have any questions, Esmeralda and myself and our applicants are still here, so happy to answer your questions at this time.
Thank you very much. That was very informative. I don't see any questions in the questions box, perhaps because it was quite informative with the detailed slides. Just one thing that I did notice, I had a question about, is this applicable for permanent residents or international students?
So as long as they have, again, for health coach, as long as they have some sort of work permit that'll allow them to go through the background check, then they should be okay. And I just want to reiterate, if they're doing health coaching, they also have to ensure that they're here between September through June and relatively within Riverside or San Bernardino County.
Perfect, thank you.
And then for FPL, it doesn't matter, your status, you can still apply. You don't have to go through a background check or anything like that. So anyone is welcome to apply if they're eligible.
Wonderful, thank you. Well, I hope our attendees will feel free to contact you for any additional questions. But if not, we'd like to thank you for coming here again on behalf of the CSUSB Center for Health Equity and everyone who's attended. Thank you so much.
Thank you. Thank you for having us. And I know there was a question in the chat about the recording. So I think they will be able to share at the end those who register this recording. And if you have any questions, feel free to reach out. Don't be a stranger. And we'll have another session as well at the end of the month too.
Perfect.
I look forward to seeing you again.
Bye, take care.
Thank you.
Thank you.